Hi everybody, my name is Talia Dostal. I'm the Education Director here at the Bateman Horn Center, and I am joined by Linda Milne, Emergency Preparedness Specialist, where we are going to be learning a little bit more today about the coronavirus and what we can do to protect ourselves and be prepared.
Great. I'm happy to be here, Talia. We're speaking to you today from the Bateman Horn Center in Salt Lake City, Utah. We are dealing worldwide with a public health crisis of the highly transmittable coronavirus that we now call COVID-19. Health professionals around the world are dealing with this challenge head on, even while they're dealing with influenza season and other infectious diseases. The professionals are providing assurance to us that at this time in the United States, the risk of contracting COVID-19 is very low. They assure us there is no need for fear or to upend our daily lives because of the virus. Keep in mind, rumors fly and bad information spreads very rapidly. We are encouraged to get our information from the World Health Organization, WHO, the CDC, which is the Center for Disease Control and Prevention, the NIH, National Institutes of Health, as well as state, county, and local public health and safety agencies. As testing for this disease expands, expect the number of COVID-19 infections to rise daily. You can track that information on the CDC site. They post new data at noon daily. States are also now doing testing, and the information is going to be on their sites daily as well. Medicare is reporting that Part B covers the cost of this test when ordered by a doctor or a healthcare provider. They stress to seniors, see your doctor if you are ill, and they direct seniors to the CDC site for information and about this particular virus. The public is being urged to take actions known to strengthen our immune systems. Now let's be real. Some of the best practices and the steps to take for immunity boosting are already challenging to you and I. But I feel a need to mention these to you in any event. They're also informative for the other members of your household. Get appropriate sleep. Stay as physically active as you possibly can. Manage stress. This is a big one. That could mean getting stressors out of your head and down on paper so that you can do something about them by making little step-by-step plans to reduce your stressors. Keep away as best you can from people who make you feel less than or load you up with negative thinking. Keep your spirits high. Think optimistically. Drink plenty of fluids, including electrolyte replacement beverages like Powerade or Gatorade. Eat nutritiously. Lots of fresh fruits and vegetables if you can. If there is an outbreak of the virus where you live, you can expect some level of community transmission. I mention this to you so that you are not alarmed when that starts happening. I want to focus today on actions you can take in your home and workplace to reduce the threat to you and yours. You know, we're accustomed to washing our hands after we use the bathroom, before we handle food. But that is insufficient when it comes to fighting this virus. I'm going to demonstrate to you what thorough, full-length hand washing looks like. And you may be rolling your eyes about that because we've been hearing about that since we were in grade school. But we all need to be reminded, because we all get quick and careless about hand washing. And it is a primary defense against this illness and other infectious diseases. So share this with your household, especially your kiddos. So I'm going to show you what the correct hand washing technique looks like, and I'm going to do it for 20 seconds plus, which is the required minimum time.
It feels like a long time when you're doing it.
You're not kidding. I was watching just as I was washing my hands before I sat down here. And I realized that I was tempted to stop earlier than 20 seconds, so I kept going. So we're all having to learn this, but it's important enough that I'm going to stress. So this is probably something you know, you're from the medical field, but some of the audience may not know. So what I'm doing is I'm going to have you imagine that I'm putting my hands under a stream of water, and I'm putting soap, good hand soap, into my hands. So the first thing I'm going to do is I'm going to rub my palms together. I'm going to wash the back of my hands. I'm going to go between my fingers and up and down the length of them, between my thumb and fingers. Then I'm going to lock my fingers together, and I'm going to rub and scrub the back of my fingers, my nail beds, under the nails, pushing some soap under the nails. Then give it another wash, and I'm going to my wrists, and I'm going to rinse, and I'm not going to use the family towel when I dry. I'm going to pull a paper towel. I'm going to wipe my hands totally on this. I'm going to roll it up, and then I'm going to discard it safely.
How do I get under like your ring? You
Well,
know, your rings, and I always forget about my wrist if I have a watch on.
That's true. I just push my watch up,
Okay.
and some of my rings I take off, and some are just easy. You can't even see. But while I'm doing my fingers, I'm moving my ring up and down.
Okay.
It's quite easy. Or you can just take them off. But we end up losing rings anyway.
Yes.
So I suggest just moving them up and down your finger to get under them.
Okay.
Unless you're wearing a computer like I am.
Yeah.
Okay. Now, when you don't have access to soap and water, and that happens to all of us, alcohol-based hand sanitizer is your friend. This is what you want. And put it, you can get small bottles of it, put in your car, put it in your purse, put it in your tote, your computer bag. You want it nearby. But don't overuse this. This is a backup to soap and water. So when you have the choice, never choose this. Always choose soap and water. When you overuse this, they tell us that it loses its effectiveness for us. So that's why I'm pointing that out. Use in a pinch. I want you to keep your homes sanitized. This is really important, and this is something you have total control of. Wash your dishes in very hot soapy water if you don't have a dishwasher, like I don't have. Clean surfaces in your kitchen. Use wipes. In this case, this is a Lysol brand. There's Clorox is another popular brand. You pull out the wipe and you can clean around. And you'll notice 99.9% killing of germs. That's what you're shooting for. You're either using wipes or you're using a spray. Again, there's a couple of brands. The most popular are probably Clorox and Lysol. Again, 99.9% killing of germs.
Now,
So,
Linda,
yeah.
I don't know about you, but I'm finding it really hard to find these in the stores right now. What do I do if they're out? Can I make my own home remedy?
Let me tell you, you're exactly right. I have a stock of these because, hey folks, I prepare. So when this crisis hit, I didn't have to go to the store to get anything. That's the beauty of being someone who prepares for emergencies. But I wouldn't hesitate making my own. So Most of our homes have Clorox bleach. You can make your own sanitizing fluid. 1 to 2 tablespoons of this per gallon of water. So once you get your gallon, you want to put it in multiple spray bottles and put them in your kitchen and your bathrooms. And you can also put paper towels. I tried this morning in a solution I created. I just put paper towels in the solution, and I ended up with, basically the same thing I pulled out of the Clorox dispenser. And it was a lot less expensive. But here's the thing about making your own. You must use pure, full strength Clorox bleach. It doesn't have to be Clorox, but bleach, full strength. Make sure that it doesn't have any additive like FiberGuard or Fresh Scent or any kind of scent that they put in to kind of quell the odor that Clorox bleaches have. You don't want any of the additives, plain old bleach.
Now I imagine we probably want to make sure that the bottle's labeled, so no little kiddos or anything get a hold of it thinking it's just a water.
That's a great point. And let your whole family know what you're doing and why this spray bottle or these products are in your kitchen and bathrooms, because you can't be the only one to keep your home sanitized. The other people that are using your kitchen and your bathrooms and are in your home, they need to be a part of this. They need to clean up after themselves. They need to do their part in keeping your home area sanitized.
One more question, I'm
Yes.
sorry. Should we use gloves when we're using this? The Clorox itself, as a wipe if it gets on our hands, or just kind of double up the paper towel or something like that, so we make sure that we're not also getting the caustic chemicals on our hands.
I'll tell you, I use these when I have cleaned up in my kitchen. I share a home with my brother who lives in an apartment downstairs, but we share the kitchen. So I am going around, I'm the refrigerator door handle, the freezer, the knobs on the stove. I'm doing the faucets, the handles to turn the water off and on, the button on the front of the water filter, the surfaces, cutting boards, things like that in the kitchen. So when I'm finished, I just kind of do this before I throw it away. So far, I haven't noticed a problem with my hands, but I'm chemically sensitive, so it wouldn't be unusual for me after using this chemical to go to the sink and wash with a nice soap to get it off my skin. But that's me. But there's no reason that you need to walk around with the chemicals on your hands.
Thank you. Yes,
okay?
and you also pointed out a lot of good tips in the kitchen, just thinking through all the places that we touch that, then you're going over and preparing food, and then that's what so you kind of taking me through the kitchen setting can help me frame what I might do in other settings, like my bathroom, or even, my door handles going in and out of the house, that kind of thing.
Right. I am forever doing my door handles. Because again, there are 2 of us that are handling everything, and my brother and I are out in the public in different places. So we're bringing friends with us on our hands.
Yeah.
So we've got to take care of the door handles. Tally mentioned these products are scarce. That's why I gave you the recipe for making your own. And I'm going to repeat it again. 1 tablespoon, 1 to 2 tablespoons of bleach, full strength bleach, no additives, with a gallon of water. That's the recipe. So don't feel that you have to panic because you can't get your hand on these commercial products. They are scarce. In some areas, they've been scarce for a while. The reason that I talked about hand washing and went to the extent of showing you how to do it is because our hands touching our eyes, our nose, and our mouth are the main entry points for disease. So keeping hands clean is very important. The other thing to try and start training yourself, keep these paws off your face.
I just caught myself doing it too.
Unless you have just washed your hands. But let's say you wash your hands, you touch your face and your nose, you've got to go back and you've got to wash again. You've got to think these hands have to stay clean and as pristine as possible. Stay away from your face, and we all do it 100 times a day. Touch our face. Try to not do it anymore unless you. The same products that we use in our home, including the homemade, are what needs to be used in the workplace. Now, there's also the message that we should stay as much as 6 feet away from people that we're dealing with. So you have a meeting environment. Try to keep some distance. We're not 6 feet apart, but we've got to stay. We want to stay in the frame to present this to you. But if we were having a staff meeting, I would make the suggestion that we separate each other a little bit. And some businesses are already starting to talk about having some of their employees work from home. Is that possible in your workplace? It is a sensible possibility. In a few cases, some businesses are going to elect to close temporarily if transmission is happening in the community in which they are located. So when you hear about these things happening, I don't want you to panic. These are things that are expected to happen as a way of controlling the transmission of this very highly contagious disease. When you're sick, don't go to work. If you're sick and you have a social event, don't go. People are going to understand, and if they don't, maybe they need you to educate them about this. Avoidance is a key effective transmission preventer. So keep it in mind. When you cough and sneeze, this is something else you all know too, but I'm going to remind you. You cough and sneeze into the inside fold of your elbow. You've got a lot of mass there between you and the droplets that you might be sneezing or coughing. If you can't do that, please don't count on flimsy tissues. I'll tell you one of the things I do. If I'm around in my car and several places, I have paper towels. I fold them over and I use them. I stick some in the outside pocket of my purse. I stick some in my pocket, just because this is not something that you're going to find out and about. You're going to see tissues. Some tissues are strong, but others are pretty flimsy. This is just another approach to dealing with containing the droplets that we release when we sneeze and when we cough. This is a good time to start thinking about no longer shaking hands during this season. And this is a hard one for me. It's probably a good time to stop hugging when you're greeting people. So maybe you don't feel the urge to do it now, but I put your attention on that. These are ways that illness gets transmitted. So we have to make, changes in the way we do things, even if we don't like them. Now, when I go shopping, I like to do self-checkout. So there's a lot of buttons to push and a lot of things to do. I trained myself a long time ago to use knuckles instead of fingertips. I don't use the pen device that they have with machines to make these selections. So don't use that device. Don't use your fingertips, because you're going to be walking away with other people's fingertips, right? Use your knuckles, because you're generally not going to be putting your knuckles to work in your face, your nose, and your eyes until you can get to a place where you can do a thorough hand and soap washing. And I urge you to do that every time you have gone from your home and you're returning. Every time you step out from work and go get lunch and you come back. Wash with hot soapy water.
Now, Linda, what happens, I've been seeing this more, at least in our grocery stores here, where they'll put the hand sanitizer next to the little, whatever little kiosk thing is.
Yes.
So, I mean, like sometimes you have to sign your name and whatnot. Is it appropriate then, at least as some form of management, to use it and then use the sanitizer right afterwards, where you know that you won't be touching any of the other devices?
That's a good point. That is true. Occasionally you're going to have to sign. I use cards where I don't have to do that, so I didn't think of that. So thank you for reminding me. Now, I want to talk to you about PPE. Now, you won't know what that is, but I'm going to tell you. It's personal protective equipment. Masks, gloves, gowns, goggles, shields. This is all considered personal protective equipment. When you see images of people in other countries that are battling this disease further along than we are in the United States, everyone's got a mask on.
Mm-hmm.
You don't see people out in public without some sort of a mask. And there are a variety of them. But here's the thing. Because this is a global epidemic, these products are near impossible for you as a consumer to purchase. Panic buying is going on, and people are carelessly buying more than they need. They may be buying the wrong things. But here's the worst part. You are perhaps taking home products that need to be in the hands of healthcare professionals. Do you know that this has become a major problem? To the extent that the World Health Organization has sent out a warning and said, I want you to hear their words. The World Health Organization has warned that mounting disruption of the global supply of gloves, medical masks, respirators, goggles, face shields, gowns and aprons, caused by rising demand, panic buying, hoarding by the public, and misuse by the public, is putting medical professional lives at risk. Shortages are leaving frontline workers dangerously ill-equipped to care for patients and prevent transmission. So those are not my words. Those are the words of the World Health Organization.
So then what do I do, Linda? I mean, we see this, we're just infiltrated with information right now. And I know that, we're talking through how we need to prepare our homes and take care of everything. And we still have to go to work so long as our businesses are open and whatnot. What do you advise we do, as far as trying to continue forward in our daily life while also trying to strike the balance on not hoarding too much of the supplies, to ensure that the supplies go where they need to in order to, have healthcare professionals perform their job duties? What do you advise we do?
That's a perfect question because it leads right into what I want to say now. And that is that one of the things that might reduce your anxiety that you don't have masks and you don't have gloves, these are single-use items. So if you're going to work, 20 days or 22 days a month, then you would need 22 sets of these products. So we've got to look at it in a different way, because even if we had products, probably none of us have enough to get us through consistent work days, to get us out and to go places that we need to go. So here's the truth of it. The strongest deterrent to getting sick from this illness is avoidance. Straight out, that's the bottom line. Now, what does that mean? Does that mean that you decide not to go to work? Does that mean you don't associate socially anymore? I think it's a family decision how we approach avoidance, whether it's staying home or whether it is relying on personal hygiene and sanitizing, keeping our home and our workplace as germ-free as possible. So that's my suggestion. These are the kind of masks that you see when we walk into a hospital lobby or a doctor's office. You see a lot of this, yellow, white, blue ones. But these are not effective in fighting a deadly virus. So I hesitate even telling people about this because it's not effective. It may give you a false sense that you have protection when you don't. But when you see these in images from all over the world, these people are protecting themselves primarily from dirty air that is full of particulates that are damaging to lungs.
Why not this one versus some of the other ones? Why is it not as effective in this particular situation when we're talking about droplet precautions versus particulates in the air?
Well, I'll demonstrate one of the reasons why. When I put this on, I can put my fingers under this, not even touching the mask. It's not adhering to my face, my neck. I can pinch this in and get a better seal up here, but it does nothing for this and very little for my neck.
Okay.
So that's the reason why. Now, the masks that professionals rely on, and if everything were right in the world, we could have these in our own personal emergency supplies. These are just two different kinds of masks from different manufacturers in different places in the world. This mask came from 3M, which is a main manufacturing source for all kinds of masks and all kinds of purposes. This mask is an N100, which means it keeps out 100% of particulates.
Oh, okay.
If it is properly worn and properly seals. That's the key. This particular mask has a little shield that goes with it to protect the eyes. And the mask is made of a material that kind of adheres. You press it against your cheeks and necks, and you've got a good seal. That's what makes this an N99 instead of this, which gives too little protection.
So we have N100s, N199s, and
N95s.
And N95s, okay.
And as you go down, you're trapping out less and less particles. So an N95 is not as effective as an N100. But the N95s are more plentiful, and they will probably be the earliest masks to be restocked once the retooling is happening and they're getting back on shelves around the world.
Are they still single use?
Yes.
Okay.
Unless what you need to do, like this mask right here, it costs over $12, and it's single use. You see, you've got to have other avoidance strategies besides masks. Now, gloves aren't expensive like this. You can find the blue nitrile gloves, latex gloves. If you have a chance to get some, I would suggest that you do, to get a box for your family. Get the powdered ones that are inside if you can, they're better on and off. But if you're using gloves, as you know, Talia, when you remove them, you remove from underneath and you pull the glove inside out and discard. They're single use only. So it's pretty complicated.
I imagine even taking off the glove, if you have, both both gloves on, both have been touching stuff. You don't want to touch your skin as you're trying to take it off, right?
Good
Because then you have to
point.
wash your skin. Now, once we get the gloves off, is it still a good practice to wash our hands afterwards?
Yes,
Okay.
absolutely, especially up here where you didn't have a tight seal
Right.
on the end of the glove. So you've used the glove for protective purposes, but this part was not protected, and this part was not. The fingers were, and the palm.
Yeah.
But so yes, washing and making sure you catch up here.
So, you know, the coronavirus is taking the stage right now, but we still have the flu and viral pneumonia. We still have crud floating around in our communities all over the place. Are these practices that we've talked about, from hand hygiene to awareness to preparedness to keeping our stations and our home life clean, is this something that I can also use to kind of starve off all the other cruds out there?
Yes. I would say if you can make friends with some of this information, thorough hand washing frequently, using sanitation products. If you can make friends with bringing this into your life, I would say never leave it out of your life.
Yeah.
Because, we know there's a flu season, and we know that during the cold weather is when it is primarily happening. But some infectious diseases are year-round, and even strains of flu don't go away.
Yeah.
They just reduce once hot weather comes.
Thank you, Linda, for your time. I think the most important thing that I took away from this, two main points, is one, ensuring that we're getting accurate information from validated resources, and not getting caught up in kind of the frenzy of overload of information. And two, trying not to feed into the anxiety of what's happening, but rather kind of feeling empowered in the fact that I can be prepared. And I think part of that preparedness really is being aware. You kind of talked me through some of the situational things that I can start implementing from my workplace to my home place. Being out in the community, it's not necessarily saying that I need to freak out and hide in a hole, but if I can avoid exposure, that's the best option. Otherwise, the awareness and preparedness is really what's key right now.
It is. That's right. And thank you for mentioning that. These are our tools that can keep us integrated into our life. Whether it be the coronavirus or the flu or whatever comes up next. So thank you so much for your time, Linda. You're welcome. We'll see you guys next time. Bye-bye.